but that the friction between two of my vertebrae had caused a fracture. So I had a broken back. And I was like, got it. When can we schedule surgery? But he responded and said, well, the problem is your weight. Unfortunately, we're going to need you to lose some weight before we would be willing to do surgery on you.
Yo-yo and hello, my name is Lydia, and on today's episode of my 25-pound yo-yo, we will be talking about equality, equity, and entitlement. 3 E words that have a lot of overlap and a lot of debate. Now, I personally think that equity is giving accommodations to a person so that equality can be achieved. But whenever choice gets into the conversation, well, to me, equity turns to entitlement. Now, before we get into the TikTok, I think we need to learn a little bit more about equality, equity, and entitlement. So why don't we watch this next clip, then come back and discuss. Equality, equity, and entitlement. Equality is the state of being equal, especially in status, rights, and opportunities. Equity is the quality of being fair and impartial. Entitlement is inherently deserving of privileges or special treatment. Okay, so what's the difference? Equality is demonstrated by offering all people the same products and services. Equity is giving people accommodations to do the same job or have the same services. Entitlement is demanding a product or service for no good reason. Let's use parking as an example. If everyone has access to parking, that's equality. If we make enough accessible parking spots to cater to those that are disabled, that's equity. But if someone who doesn't qualify for an accessible parking pass but parks there anyways, well, that's entitlement. I think it comes down to privilege and choice. If you have a choice, and more specifically, if that choice involves relinquishing privilege, it's not equity, it's entitlement. Likewise, if you have no choice in your situation, then it's likely equity and not entitlement. In the parking example, it is necessary for disabled people to have extra large parking spaces and access close to the door. They do not have a choice. The bigger spaces are a need. In order to gain the privilege of the parking spot, you have to lose your privilege of being able-bodied. With this in mind, let's do another example. If I offer to take both of my kids to lunch, I'm exemplifying equality. If my daughter is sick and can't come, my bringing her something back shows equity. But if she chooses to do something with her friends instead, but still wants me to bring her something back, well, that's entitlement, because there was a choice to be made that involved relinquishing privilege. Now, sometimes it gets trickier when people don't acknowledge their existing privilege and think it's equity when it really is entitlement. So let's do one more. Let's say I got into a car accident, and as a result, I had a temporary injury that allowed me to use the service elevator at work. Now, this injury should be healed in about 4 months so long as I do my physio. But if I refuse to do my physio and my elevator pass expires after 4 months, am I entitled to another pass? Is it equity because I'm still hurt? Or is it entitlement because I didn't do my part? To me, equity turns to entitlement when I can't becomes I won't. So now that we know more about equality, equity, and entitlement, let's watch Hannah's TikTok about her back surgery story and see what sort of behavior we can identify there.
Story time. I have had severe chronic back pain my whole life, ever since I was like 5 years old, and I have done literally everything imaginable to try to make it better with little to no success. My pain got progressively worse over time, and about 4 years ago when it became particularly severe, I decided it was finally time to consider surgery, so I made an appointment with an orthopedic surgeon. At the appointment, they weighed me, they x-rayed my back, and then they had me wait for the doctor. The doctor came in and very quickly let me know that I needed to have a spinal fusion surgery, and I needed to have one as quickly as possible. He showed me the x-rays and explained that I not only had a spinal deformity, which I already knew, but that the friction between two of my vertebrae had caused a fracture. So I had a broken back. And I was like, got it. When can we schedule surgery? But he responded and said, well, the problem is your weight. Unfortunately, we're going to need you to lose some weight before we would be willing to do surgery on you. But luckily, we have an in-house weight loss program that we're going to refer you to. And there are many things I could have said in response to this, but I decided to try to appeal to this doctor as someone who, in theory, should want to do no harm. So I told him, I have a history of disordered eating, and weight loss behaviors are very unsafe for me. And by the look on his face, he clearly did not believe that I ever had an eating disorder. And so he said again that I would need to lose weight, and he said the reason was because anesthesia was too dangerous for people in my BMI category. And I said, so how do people even bigger than me get weight loss surgery every single day? They are under anesthesia for that. And we went back and forth for a long time, and he ended up getting very frustrated and just said, look, I don't know what to tell you. This is the hospital's policy. So I had to battle this hospital with this horrible BMI cutoff policy for a whole year, all while having a broken back that entire time before I could finally get the surgery they had established was medically necessary. And by the point that I was finally able to get this surgery, they had made me wait so long that over the course of that year, I had developed permanent nerve damage, which is extremely painful to this day and has radically changed how I have to live my life. And that would not have happened if they had just given me the surgery on the same timeline as a thin patient.
So let's start by ruling out the first one. It can't be equality. In this situation, Hannah is being offered back surgery. She is not being denied back surgery. She is being offered back surgery. However, she has a prescription and she needs to do her part. This is no different than if you go for an ultrasound and they tell you you have to drink water ahead of time. You have to do your part. Or if you go in for an operation and they tell you to fast the day before, you have to do your part. Her part of getting ready for back surgery happens to include losing weight. No, they don't prescribe that to everybody. However, they do say that you have to have a BMI under 40 in order to get said surgery. So she is actually not being treated any differently than anybody else. This is equality. So at most, what Hannah is asking for is equity. She's asking for accommodations so that she can have the surgery. But is it really equity? Because if you have the privilege to obtain the prerequisite, which is the BMI under 40, I don't see this as equity anymore. I see it as entitlement. And not just any level of entitlement, like the super highest level of entitlement. Let me explain. I categorically see entitlement in 3 tiers. The type of entitlement which is of little to no consequence to the person that is giving in to the demand, the type of entitlement which inconveniences the other person, and the type of entitlement that poses a risk onto the other person. And guess what? Hannah's example is that third one. You see, the level 1 types of entitlement, I would say, are the things like when someone takes 2 candies out of the candy jar instead of 1. Well, they weren't exactly entitled to take 2. The sign said take 1, but it's a really small consequence. So it's kind of you were entitled there, but it's not a really big deal. It didn't really hurt anyone. Now, the second level of entitlement is when you inconvenience someone. You know, something like if I go out and I don't feel like taking the bus home and I call for a drive. I'm inconveniencing my partner to come and get me, but I'm not exactly hurting him in any way. I'm just getting him to do something that he doesn't really want to do. Now, the third level of entitlement is when you impose risk on the person that you are demanding the service or product from. And that's exactly what's going on here. When what you're asking for actually hurts or harms the person you're asking it from, well, that's entitled. So let's look at the risk that Hannah is asking both the doctor and the hospital to ensue for her back surgery. Now, the reason why hospitals have that BMI cutoff is because doing surgeries on morbidly obese patients is extremely risky. You need more of everything. You need more space, you need more care, you need more blood, you need more attention. It is extremely, extremely dangerous. And obese patients, keeping them alive during the procedure is extremely high risk. They could stop breathing, they could run out of blood. A lot of things could happen. And most hospitals do not want to ensue that kind of risk. I looked it up, and there is a 20% increase of complications if the person has a BMI over 40. Now, that's ridiculously high, and I don't think I would want an increased risk of 20% on anything that was within my control. Hannah made the argument that bariatric patients every day that are much larger than her have to have anesthesia for their surgeries. And that's true. But she didn't address that those two surgeries are completely different. Now, I'm not a doctor, but I'm going to speculate of 3 different things as to why her surgery was not approved, but bariatric surgeries are. Number 1, the position of the patient. Now, I don't know a whole lot about surgeries, but I'm assuming that if you're having back surgery, you have to be on your front. And a lot of people have a harder time breathing on their fronts. So maybe the anesthesia on a surgery when you're lying on your front is perhaps more dangerous. And perhaps if you are morbidly obese, there's a higher risk that you might stop breathing. The other consideration I had was that bariatric surgeons are trained to deal with obese clients. That is what they do. They are very, very well skilled in dealing with fat. They know how to manipulate it. They've spent lots of time developing their skill because bariatric surgery is for obese people. Now, a back surgeon, he specializes in the back. He knows how to fix a back. Should he have all the knowledge that a bariatric surgeon has about how to navigate excess levels of adipose tissue? Is that fair? Isn't that why we have specialists, that not one person can know how to do everything? To me, it's unfair to expect a doctor to also be an expert with morbidly obese patients and also be an expert in back surgery. And the third consideration that I thought of was, well, treating obese patients with bariatric surgery is treating a root cause, because if they can figure out how to operate on obese patients for bariatric surgery and ideally cure them of their obesity, then they don't have to figure out how to do all the other surgeries on obese patients, because we won't have as many obese patients, and being obese is not healthy in the first place. So that level of risk might be something that people are willing to ensue for less risk down the line. Hannah also mentioned that she has had back problems her entire life, and I'm not going to question her on this. I do believe that her back issues are genetic. However, obesity compounds these sort of issues. I looked it up, and obesity does cause fractures in the spine, and her increased weight has likely impacted the existing state of her back. Now, considering that Hannah has already had a breast reduction surgery to limit the pressure on her back, I really, really doubt that this is the first conversation about her back and her weight that she's had with a doctor. So that leads me to believe that she has likely had over 30 years to address her weight. And the doctor is being held to blame for 1 year of waiting for her surgery. Why isn't Hannah being held accountable for the 30 years that she stayed obese? Then Hannah brings up the physician's vow of do no harm. But isn't that what the doctor is doing by refusing to do the surgery? Doing no harm, meaning I could do harm if I operate on you. So I am advising you to lose weight so that the operation will be safer, so that I do no harm. And the other thing I'd like to address is, why don't we live our lives with do no harm. Like, how is this fair to a doctor that we can live our lives in harm, 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 and then expect the doctor to undo the harm? Like, the doctor has to do no harm to several people. You only have to do no harm to yourself. Next, Hannah states that it is unsafe for her to lose weight. And I am not going to be callous or say, oh, just put the fork down, because I know it is much more complicated than that. I know that there are a lot of emotional issues that go into that. But I also don't think it's any different than dealing with any other addiction. This is no different to me than a smoker that has lung cancer that still refuses to quit smoking. The work to get through an addiction is hard. It's very hard. Ask any recovered alcoholic or addict. It's hard. And it's no different if your addiction is food or sugar. We just seem to have normalized those addictions in society. But the solution is never to just give up and give into your addiction. When Hannah says that it's unsafe for her to lose weight, how unsafe is it for her to have a broken back? It's time to pick some priorities. If your health means so much to you, do the work. Do the emotional, hard work and get through your issues so that you can achieve a healthy body. So, in this story, Hannah was trying to illustrate inequality to us, but all I saw was entitlement, because she has a choice, and more importantly, counter-privilege, because she has the privilege of not dieting, and she doesn't want to relinquish that privilege of not dieting in order to have back surgery. There is both privilege and choice here, and it's not just entitlement. It's the worst type of entitlement. It's the type of entitlement that adds risk to the person giving in to the entitled demand. And of course, if this is opened up to Hannah and any of the other fat activists, we're met with another E word: excuses.
One person will pop their head out of the ground just to say, you can lose weight in a healthy way. It doesn't need to be so extreme. And I don't know how else to explain that for me and for many, many other people, that is simply untrue. Because the second I start ignoring my body's cues, it's over. The instant my body tells me it is hungry and I choose either not to feed it or to underfeed it, which is what a calorie deficit is, it knows it's time for famine. It goes into scarcity mode.
But I will have to save that one for another day. So until next time, yo-yo and let's go.